handstand with myself. Have the client wash, because this way you don't have to use the witch hazel and the pads. And both the clients and yourself are clean. And so then it starts going the exact same rules as what you would have with the foot reflexology. So with this, now when I'm holding their hands and when I'm turning them, I cup their hand and then I'll turn them both ways. So I'm not just lifting them up and moving. I'm actually delicately, doing it. So when you are going to look at their hands for checking to see if there's any issues of warts or bruises or cuts or calluses or anything like that, that's what you're going to check for. So with it, I can also check to see for color. If the nails are quite a blue, it might be then their temperature. If also their hand temperature. With the temperature for them, if they have very, very, very cold hands, then I know their circulation isn't coming in. On with Teresa's, her knuckles are just a little bit red. With it, that's common on quite a few people, so that isn't something that you would necessarily, she might have just had like with lunch or something too, depending if the food changed, if you were gripping, so if somebody was stressed. There's other things too that can happen, but her hands are quite normal. Like that is quite a normal way. On the inside, too, some people might have very white. So if you're moving your hand and you see that it goes white to red, that's normal. It just means blood circulation is there. Okay, and she doesn't have any calluses or anything that I have to worry about. I'm just going to check the other one too.
They're really itchy.
Are they? They're a little warm. Yeah. Okay, so when you're going to start, you would start now the same way that you would with foot reflexology. So I'm going to turn it over and I'm going to zone walk the hand. And the only difference is I'm going to do it with my fingers instead of my thumb. And I'm going to zone walk it down, and I'm going to do 2 at a time so that it just reaches it all together. Now, a person, if you want to, you can do them 2 or 3 times, depending how much time you have for your client. And if you're going to do a half-hour session, or if you're going to do a full-hour session, or if you're just going to do a quick 10-minute, you would change of what you want to do. Okay, if I'm going to do all of the brain area, you would just come over each finger in individual. I'm supporting her fingers at all times so that I'm not hurting her in any way. Okay, your sinuses, again, you'd want to pinch you. So if I'm going to pull up on sinuses, and I'm going to come up onto her, like my thumb is protecting the first knuckle and then pulling up. Some people pinch, but then if she had any sores, then I don't know how much I'm pinching. So if I'm pinching me, then I'll know how much pressure I'm putting in. So with it, to do the other side, if you're going to zone walk the other side, you just do the same. Now hands naturally have a cupping effect, so she just has her hands over top of mine, so it's just kind of cupping. And then I can protect her knuckles because I don't want to do the knuckles the opposite direction. You can do relaxation techniques. So with it, at any time that you feel that you need to do a relaxation technique, just add it in. Nice one is a knuckle rub. You can also do your thumb rubs too on them. You could go across like you would on the foot. Okay, so now if you're going to start doing all the points, now your thumb is just like your big toe. So you have your mouth and your nose, the pineal, which would be on the inside. You would have the pituitary. Now the interesting thing, and you can usually see it on the thumbs, is if you look at your thumb, they say where the swirl goes, right in the very middle, where that swirl tip is a lot of people where the pituitary is. You're going to get into the hypothalamus. Again, usually the trigger's 3 times. You can come and do your thyroid and your tonsils. Again with the eyes and the ears. Inner ear, just do it lightly, just in case, so just straight in between. And again, at any time that you want to, you can add in relaxation techniques. Now, doing the shoulders, so right up and top, you're just coming in, right in to where the hand joins, so right in where the meat is here. And I'm really wanting to go down into her hand, not up into the fingers. And I'm just walking it. Is pressure okay? And then you can relax it out too. Now the teeth, so on the bottom of the knuckle closer to the hand are your bottom teeth, and then your top teeth, and it's just a light pinch on all of them. When we do the feet, we usually do the upper, the middle, and the bottom plantar. But when we do the hands, because there's not a lot of space in here, you're going to zone walk it all together. And again, you can do it with 2 or 3 fingers. And you're just coming down. Again, pressure okay? You can also come across. Again, make sure that your nails aren't too long because you don't want to get right in them. And you would turn your hand over. And here, if you want, I can use my knee. If the pillow was on top of a table, then they'd have their own weight and I wouldn't have to worry about it. But being that it's on my leg, so if I was just out in the open and I didn't have a table somewhere to use, I would have the pillow over top though if I did, and then still the towel over top of that for comfort. But if I wasn't, I could do it in my lap if I had to. And this way I'll put my knee underneath to kind of use it as support, and then if you want you can do the snow plow. So in the upper part here, what we're going to do then is you do have your triggers, because we've zone walked it all both ways. So really we've done everything. So your triggers then would be the same as what they are in the feet. Now the only difference is where they're placed. So what you'd have is your kidneys, and you would hook it 3 times. Your adrenals are just above the kidneys. In your right hand, you would have your liver, and your liver would be kind of more underneath the little finger. And so you can get into there, and mostly what I get into is there's a crevice, like a little, right between the metacarpals, you would have like an indent. And so you'll feel it in the person, and so then you can trigger into it 3 times. Now, when you're going to walk the large intestine, with this one, if you want to walk with it, you'd have to come up, and I thumb walk it, come across to the waist, which is about mid of the hand. And so if you want to walk it 3 times, you can, and that way you've also triggered all the flexures. Now, if the kidney goes the opposite direction, if you want to walk with the bladder, with the ureters, comes down and around. And then your bladder just sits pretty much right on the bottom of where your thumb is there. You can trigger it 3 times. And again, relaxation anywhere that you'd like. Okay. Your sciatic is also down just a little bit further in the uterus. On the other side would be the ovaries. If it was a gentleman, it would be the testes and the prostrate. So pinky would be the testes, and big thumb would be the prostrate. To do the rectum, some people do a sweep, so you can come up the arm to do the rectum. You can also walk it if you'd like. So it depends which you're going to feel is better. Turning the hand over. Okay, so in here what you have left is your groin and fallopian tubes, lymphatic area, right where the hand bends. So you'll feel a soft spot in here. You're just going to finger walk across, finger walk across. If you do your edema spot, same as like with your ankle, you find the soft spot right where the hand is, and you can pump it. So just the same. Okay, coming down the arms and the legs. Is it with that? Okay with that one? So you're coming down. Now, if you're going to do the spinal column, you're doing the thumb. So I'm coming down. I like going the whole thumb all the way down back to the wrist. So you're doing the spinal column all the way down. Plus you can go across. Your lymphatic point to drain, right at the base, just like on the big toe. There's a soft spot right where the bones meet, and so then you can compress it 3 times for the lymphatic point. It's okay. And on the front, like on the front here, we had already done it with the snow plow, but it's the chest, breast, and rib cage, lungs. Okay, so you would change your chair over to match the other side. I usually literally move myself from the right hand to the left. Now for the video, we actually switched it, but
So
normally
you would just go over here.
I would just move my chair right over, yeah.
Okay.
So now you would do the same thing that you just did with the right hand. You would zone walk. So you're zone walking all the fingers. And there's no real reason that you couldn't start with the big thumb. Like, it's just whatever you consider. And again, you can do it a few times with each, whatever you have time for. Pressure should be just enough that they can feel it, but not where it's major pain. And it's going to feel different on them with their hands, because there's a lot of sensors in their hands. And then just cup their hand every time you turn it. And you want to make sure you get all the zones.
Just a line.
Yeah, just to the shoulder ridge there. And you can put relaxation anytime in it. And anyone's. Slightly hold their fingers and do the brain reflex over top of each one. And we're just holding their fingers to support them. if you're going to do the sinus, you're just pulling up on the pad, so you're really just pulling up, and you're just supporting so that you're kind of pinching you as you're doing them. Okay, so as we're moving down now, you can do your thumb if you like. So it's the mouth. You're going to hook into the mouth, the nose. On the opposite side is the pineal. If you're doing left hand, to get into the hypothalamus, you have to use your other hand usually. Pituitary, right in the middle of the thumb, and you're hooking in 3 times. Tonsils, thyroid. So you're going, then you have your eyes, ears, inner ear. This is right in between. Just be careful on some people, it might be really tender. Teeth, just a light pinch, upper and lower of the knuckle. Same with the thumb. Okay. Now, moving down again, you're going to zone walk. I like using 3 fingers, but you're going to zone walk all the way down the palm of the hand. A person could use your thumb, it's just a lot easier using your fingers with the hands. You can also come across. So you're doing your vertical and your horizontal. And then whatever relaxation techniques that you like. Here now you're going to do the shoulders, so just support their fingers so that so my underneath hand is supporting their fingers so I can walk that shoulder ridge. Relaxation again of whatever you like. Now in here with being the left hand, again you're going to have the kidneys, so you can get right into the kidneys and hook it 3 times. And the adrenals, just up a little further. Now on the opposite side, what you have here though is the spleen. So you're going to hook the spleen 3 times. Now walking the intestine here kind of goes in a kind of a curve with it. So depending which hand that you want to do, you can do both. And what you also have is from your kidneys, you have the ureter going all the way over to the bladder, hooking the bladder 3 times. Either side of the wrist, you have either the testes and ovaries or the prostate and the uterus. Down just a little bit lower on the pinky side there, you have the sciatic. Again, you can do either the walking of the rectum. So the rectum, you can do the sweep or the walking, whatever you like. From here too, if you want, I usually switch over to now do again with my knee, I'm just protecting the hand, and then I'm going to snow plow down. And then on the wrist is the groin lymphatic fallopian tubes. Again, I'm going to find the edema point, which is a soft spot right in the wrist where it bends, and now I can pump the hand while I push the edema. And then relax it. Turning the hand back over, I can do the arms and the legs. With the thumb, just make sure it's protected too. I can do the spinal column all the way down. And also the other way, so you're doing it vertically and horizontally. You really only have to do to the first joint. I like going all the way up. Okay. So once you're at that point, then what you have now is the cream. Once you have the cream, a lot of times I warm it up with my hands, and then I ask for both hands. Put it in. I just kind of start mixing it on both. Don't worry, that's why you have the towel there. And then you can start with one hand and start to rub it in. This last thing that you would do is right where the diaphragm is, you would take the solar plex area, ask them to take a deep breath. Okay, take another deep breath. So you push in. When they exhale, you're letting go. Take another deep breath.